Okay, so as you all can see, I'm still here in the hospital. And I just came across the homie's whole experience about having her pain medication protocol changed or withheld um, because they said that for whatever reason, IV push was no longer going to be allowed at her hospital. And now, seemingly, they are doing her IV pushes again, um, but not before putting her through hell and high water and everything in between. I just want to say this is not new. Um, I have been at Cedar Sinai for 37 years. As a matter of fact, it was 37 years last month on my 47th birthday, which I spent here. Um, at any rate, you want to talk about somebody who has standing protocols and nothing changes. Um, I'm one of those patients as well. And about 12 years ago, Cedar Sinai pulled that same crap with sickle cell patients. It, same crap. Let me tell y'all what happened. I go to the ER, of course. They have me admitted. I'm waiting for my medication in my room. All of a sudden, my nurse comes in. She has this extra, she has this piece of yellow paper and a pen. And she slams it down on the table and she's like, sign this so I can give you your pain medicine. I looked at her like, what? Sign what? So, oh, sign this. And then I can give you your pain medication. Okay, it's just sign permission for me to medicate you. So I'm looking at her and I'm like, yeah, no, I signed all of those papers downstairs in the ER. When I signed the paperwork for to be treated, I signed the paperwork for who's going to pay for my treatments. I signed the paperwork acknowledging that there were people here that are not on staff, but they are contractors, and I may be, um, responsible for their payment. I signed all this paperwork downstairs, as I usually do. So I don't need to sign that. So then she's like, again, I don't know why she thought if she kept slapping a little piece of paper, like somehow it was going to magically just jump into my lap and the pen was going to jump into my hand. And I suddenly was going to sign my signature to it and then go along with the BS, but whatever. So I look at this little piece of paper, this little contract, this little thing that if I don't sign it, she can't medicate me. And what it said was a contract for the treatment of adult sickle cell crisis. And it said, I, fill in my name, Marissa Kors, agree to the following uh, for the duration of my stay at Cedar Sinai Medical Center for the treatment of my sickle cell crisis. So, number one, I promise to be honest with my doctors and nurses about the amount of pain that I am in. Number two, I promise to be honest with my doctors and nurses about the minimum amount of pain medication needed in order to make me comfortable. Number three, I agree to using PO medications for the first 3 days of my admission if it is seen fit by my physician and or nurses. Okay, number four, I agree that any narcotic or pain medication over 2 milligrams will be piggybacked on my IV over the course of no less than 20 minutes and no more than an hour. Uh-huh. And then it goes on. I understand that I am not allowed to leave the Cedar Sinai campus for the duration of my admission, and I also recognize that I am not allowed to leave my floor without the permission of my doctor or nurse management. And doing so may lead to a direct um, discharge. I recognize and understand that the use of any other substances such as alcohol, tobacco, marijuana, or any other illicit drugs may interfere with my care and could possibly make my crises much worse than it is, and that if found out, if if they found out I had done so, that I might be rejected um, care by Cedar Sinai Medical Center. This is what they wanted me to sign. Hell no. And I said to her, I'm not signing that. And she said, then I'm not medicating you. And she walked out. All right, cool, bet. It was on and cracking. From that moment on, I picked up the phone. I called my mama. I called my doctor. I called the hospital administration, the nurse manager, the charge nurse, anybody that I could think of, we called. Within 10 minutes, my doctor came through that unit screaming for my nurse, and her name was Mary. And there were about 7 Marys working that day. And when I tell you, the other 6 was dipping and dodging and hiding and trying to get out the way, like, Mary who? Uh, yeah, it was that serious. And he was just going through the unit. Damn it, she is not an addict. You will not treat her that way. Damn it, where is Mary? Where is my patient? And I'm just in tears because I don't understand what's going on. Come to find out that they decided to make this little protocol because they had about 4 patients who were not acting appropriately. And rather than just deal with those 4 patients, they felt it was necessary to condemn all adult sickle cell patients to this BS and fuckery, and to basically withhold our pain medications and use the worst methods of delivering our meds to us. Not to mention the stress and the strain that it puts on you, especially when you know you're being punished for something that you never did, would never do. It's awful. Um, yeah, part 2 coming.